And here we go. Welcome everybody to another Big Ideas video. This is your host, Dr. Jeffrey Hanna here at Clear Chiropractic, where we talk about the big idea, how it is that a little problem at the base of your head can have huge impacts in terms of your health, well-being, but also how that can change the quality of your life. And this is a particular video that is important for people who are experiencing chronic whiplash injuries. That is not just neck pain, but full body pain after what would seem to be a relatively small car accident. The brief summary for everybody first is that there's a disproportionate knock-on effect. Even a relatively small injury to the neck like this does not always show up instantly. It can take a few days, if not a few weeks, before symptoms start to manifest. And because you're going to have non-localized effects, that is because you have damage in the neck, it's going to affect the transmission of messages going back up to your brain. So you can experience a potential number of symptoms that have nothing to do with neck pain. You can be having back pain, you can be having vertigo, dizziness, you can have complete fatigue, lack of energy, and it can even show up as autonomic symptoms, things that are affecting your digestion, things that are affecting your energy, things that are affecting your sleep, any number of different things. Always important then is whenever we would have some kind of a neck injury, we're not just looking for broken bones, arthritis, things like that. We're making sure that there's not damage to the smaller structures of the neck that can have that profound impact on the communication between your brain and between your body. All right, so we will share with you first the story about what happens here. When we experience any number of physical injuries, the ones that we're aware of are the kinds that can produce broken bones and bleeding. The thing about it is we can oftentimes have much smaller injuries that cause micro damage to the ligaments, the muscles, and potentially even the nerves on the inside. And this can happen from any number of different things. It doesn't have to be a major car accident. It can be learning to walk, learning to play sports, roller coasters, or any numbers of slips, trips, falls that we might experience going through any stage of life. And what can happen then is as those injuries cause a shift in our head, in our brain, in our body position like this, it can actually exert tension on your spinal cord itself. And if the injury so happens to affect your neck, that's going to have a communication issue with every nerve going up to your head, but also in turn, every nerve going down to your body. Now your brain is not going to like this. And what it's going to do is it's going to try to find intelligent ways to compensate for that. And this is oftentimes going to show up as either A, tight muscles, and B, posture distortions. These are some of the earliest signs that there's actually an injury that's happened on the inside. And the thing about it is this is oftentimes a very effective strategy, but when you compound that stress over days, months, years, even decades, those accumulative effects can start to show up in very unpleasant ways. And what do? We put it down to just a little bit more stress. We put it down to our genetics. We put it down to just getting older. Any number of different reasons why we don't think that there's actually a problem. But then when we lose about 50% of our body's overall capacity to adapt to that stress, well, that's when we start to experience all kinds of different things. And we go to this doctor, we go to that doctor, looking for some type of a diagnosis. But here's the kicker. All diagnoses are ultimately effects. The question is, what's the underlying cause? And a lot of times people don't realize that it's an injury that's occurred in the past that is showing up in our present. On the average, unless there's been like a major injury, many people don't go on to experience significant symptoms for about 15 years after an original injury has happened. So what do? In the upper cervical chiropractic world, our focus is on the alignment, the motion, and the stability of the joints in your upper neck. And everybody is different. So rather than doing twisting, cracking, popping, where you're just hoping that things magically fall back into place, we take a personalized approach. We do a series of physical neurological assessments first, and then also a series of 3D imaging. That way we can determine the exact location, direction, degree of any misalignment, any injury that's occurred in your neck. And by having that information, that becomes more of a custom-tailored unlocking of that misalignment. And by doing that, it's not just a matter of helping out the bones or the joints. It's about taking the tension out of your muscles, ligaments, and ultimately your nervous system. And when we're able to do that, your brain is able to say, thank you, that's what we needed. And then your body starts to do what it was designed to do. That is heal itself. So anytime that we're having certain kinds of symptoms in the body, it's important to recognize that where the pain is not always where the problem is coming from. This is why we pay attention to see what's going on in the neck, restore the normal brain-to-body communication, and allow the body to heal itself. Okay, now, as this relates specifically to whiplash injuries, firstly, we oftentimes think of whiplash as being a consequence of a car injury, but in reality, it's anything where the head and your neck suddenly snaps one way and then the other, either forward back, back to front, or even side to side. This can happen in a car. This can happen on a roller coaster. This can happen with a sports injury. Imagine any of the tackling sports, football, even soccer, ice skating, hockey, the list goes on and on and on. This can also be quote unquote non-impact sports, gymnastics, dancing. If you slip, you trip, you fall, even if you land on your tailbone, this produces a shockwave effect that's going to ripple through your body. Even if you land on your shoulder, your head is still going to snap one way or another, even if you don't actually hit your head on the ground. And what this can do is this can produce tension, effectively, from the vertebra and the joint injury that's imparted directly into the nerves. And a lot of times, too, people think, oh, it wasn't that big of an injury. Well, we know a couple of things. Number one is that all it takes is a 5 mile an hour or 8 kilometers an hour force to actually produce a whiplash injury. That's it. We also know that the force of gravity is to the tune of around 22.5 miles an hour or 40 k's an hour. What that means, it means that if you slip, you trip, you fall, you're talking about when you hit the ground, that's 5 times more force that it actually takes to produce a whiplash injury. And even if a person is in a, quote, only a minor fender bender, they say, oh, I wasn't really going that fast, my car didn't have too much damage. Well, that in and of itself can be the problem. You see, cars are designed to crumple when there is enough force that is applied to them. Think about any of the motocross sports or the car racing events. How is it that those men and women manage to walk away from their vehicle after, going 100 miles an hour? It's because the car is designed to crumple around them. In other words, all the force is absorbed into the car. When you've got the so-called minor fender bender, well, guess what? The car bumper didn't actually absorb the force. The force instead then goes into whoever is on the inside of that vehicle. And unless you so happen to have your head strapped all the way back, well, guess what? Boom, there you go. That is enough to produce that subtle whiplash injury. So even the relatively small, non-major car accidents can still produce whiplash injuries in people. And in this particular little paper here, there's actually a few very fascinating things that they talked about. They talked about and they look at a couple little differences. Firstly, the differences that they find in terms of if a person is hit from behind versus if they're about to have a head-on collision. And they also had a look at to see what the time difference was. And this I think is super interesting. So I've already highlighted this and let me read this for you. The onset of central pain was significantly delayed, approximately 14 days in patients who were involved in a frontal collision compared to patients with a rear end collision where the pain would oftentimes show up within a single day. By contrast, the visual analog scale, which is a measure, a scale of 0 to 10, a way of a person saying, well, how much pain do I experience, was higher in the patients with rear end collision. What does this mean? This means that if you are hit from behind, odds are you're going to have higher and immediate pain. It may not be right in that moment because you've got the surge of adrenaline, you've got the shock of the event, and all of that can oftentimes mask the symptoms. But if you're involved with a head-on impact, what the researchers have found here is that they found that there's a delayed onset of symptoms. And the symptoms that these people are more likely to experience are not simply localized to the neck. They can involve the head, they can involve the arms, they can involve the lower back, they can involve the jaw, the face, and it can also show up in other ways that's not necessarily pain-related either. Dizziness, vertigo, fatigue, breathing difficulties, and the list goes on and on and on and on. So what I wanted to highlight here first and foremost, and this is very important if a person's actually experienced some kind of a car accident, don't dismiss its significance just because you might have been able to walk away without any signs of broken bones or bleeding. There might be a delayed onset effect. And second to that, those effects may show up in other parts of your body that you don't actually associate with your neck. The reason for this, as the researchers are also going to highlight, has to do with what's known as the spinal thalamic tract. What's the spinal thalamic tract without boring you with too much neurology? This is a conduit of nerves that exists in your spinal cord, and it transmits pain information, temperature information, vibration sense, deep touch, and it also is responsible for the collective pool of information that ultimately comes from every single blood vessel in your body. It's dumped into this central conduit and it's transmitted up to your brain as a sensory pathway. In other words, it's how your brain knows if there's damage that's happening out at the periphery. Now, what the researchers in this particular study found was they found that when people experience car accidents, whiplash injuries, particularly those that are involved with frontal collisions, that there is actually damage and degeneration of this particular nerve pathway. And when that information is being processed in the brain is not getting a clear sense of what's going on. And as a result, it's interpreting and filling in the gaps as full body pain. All right, what I've got here for you is a little schematic, a cross-section of your spinal cord as it would appear in your cervical spine. So this here is a little model of the base of the head, top vertebra in the neck, the C2 vertebra in the neck, which is the anchor for all the muscles to the back of the head, down to the shoulders, ultimately into the lower back. And on the inside, this area located right through here, where you'd be able to see my finger there, you have ligaments. They are called dentate ligaments. They anchor your spinal cord onto the connective tissue around basically the canal. And that connective tissue, which is called the dura, is in turn anchored onto the bones, the muscles, the ligaments of this area. We know that these structures are involved with maintaining the normal openness of this area right here. Because, well, if that didn't happen, every time that you would be rotating or leaning your head up and down, well, guess what? You'd be compressing and crushing your spinal cord. So that doesn't happen. These ligaments then, they act like tension cables, tethers that maintain that normal relationship. And that is their normal function. The kicker is that when we have these particular kinds of whiplash or neck injuries where there's, again, not necessarily dislocations, not broken bones, but where things can shift, get damaged, get locked out of the abnormal position. What can happen then is those ligaments start to exert tension on the cord itself. It would be like me poking you in the arm like this. Doing that for a minute or two, that's not probably going to cause you any major pain or discomfort. But guess what? If I was doing that all day, every day for a few days, few weeks, guess what? It actually is going to increase the amount of sensitivity, tension. We call this neural dural tension. It is a slow motion type of injury. And over a period of time, that can ultimately lead to what's called as sensitivity. And it's where the nerves start to fire abnormally. And what I've shown for you here in this particular schematic, these little structures that you would see off to the side like this, those represent those dentate ligaments. When you have torsion, not torsion, but like a shifting side to side or a kinking of these vertebrae in your neck, again, from something going snap one way, snap the other way, there's going to be a few things that are involved. And I'm not going to bore you with too much of the neurology, but this tract that you see along the outside located right here, this is what's known as your spinocerebellar tract. This is a cluster of nerve cells and cables that are essentially sending up to your brain, well, specifically this part of your brain known as the cerebellum. This is involved with muscle tone, muscle tension. And when this area is agitated, irritated, your brain is going to make an intelligent reflex, and it's be causing the muscles to tighten on one side versus the other. Now, in the moment, that may not be a problem, but if that exists over a long period of time, well, guess what? That can lead to chronic muscle imbalances, tension that can show up in any number of different places in your body. Because guess what? Your neck, it's the conduit, it's the connection between the brain and the rest of your body. There ain't no information that goes up to your brain from the rest of your body below unless it goes up through your neck. So you may not actually have a problem with your low back, with your legs, with the sciatic nerve, with your hands or anything like that. If the problem's here, normal, it's affected, abnormal. It's what we talk about in terms of being downstream and upstream effects. In other words, if you've got tension here, downstream may be just fine. But upstream, things will not be communicating and working the way that they should be. Garbage in, garbage out. And as a consequence, we can have abnormal muscle tension. The other important one that I want to highlight then is this cluster of cells that we would have located right here in the dark blue, kind of this little triangle thing. That is the spinal thalamic tract. Again, this is the one that sends up all the information about your entire lower body as it relates to temperature regulation. It's where all of the information from the blood vessels in your body are pooled together. And it's also the one that is transmitting up to your brain pain-based information about what's happening in the periphery. Again, upstream effects. If there's a problem here and it distorts the quality of the message, then guess what? Your brain's not going to be receiving an accurate picture of what's going on. It's going to fill in the blanks, and a person then can experience chronic pain. But wait, there's more. The image that I showed you before, that would be the illustration of a kink pattern. But you can also have a twist phenomenon, and this is oftentimes going to occur when you've got one vertebra that so happens to have misaligned one way, and then the adjacent vertebra has moved the exact opposite direction. This is exceptionally common in the whiplash injuries. Why? Because it wasn't just a solitary thud. Your head goes one way and then it goes back the other. In other words, you can get two injuries for the price of one. And when that happens, when you've got this shearing or this torsional effect going in oppositional directions, not only is that going to be affecting those pathways that I'd already illustrated here for you, but you can see that it has much more systemic effects and can show up in any number of other ways. In other words, you can have more complicated situations from whiplash injuries than you can from just a solitary knock to the head. So it's important that you appreciate this idea of upstream and downstream effects. because that's where we're going to be going next here. I'm going to show you in this study where they are looking at the function of the spinal thalamic tract in the brain as a consequence of a whiplash injury. Again, the damage can occur here, but the knock-on effect going up higher to the brain can be more profound and have disproportionate or compounding effects the farther that you go upstream. Alrighty, so in this particular little graphic from the study here, you've got a slice of the normal activity that's expected to see with, advanced kinds of imaging studies, where you're looking to see, well, how well is that spinal thalamic tract actually transmitting the information up to the brain? Normal, you can see that the pathway that they've illustrated here all the way in green is where brain is receiving good quality and the right amount of information. But what the researchers were finding is they're finding that when there have been these neck-related injuries, that these pathways become narrow and where they are not actually transmitting the normal volume of information at all. Now, here's the interesting thing as it relates to the injuries. These injuries involved the neck. They did not involve the head. And yet we're seeing that the brain itself is being affected from the problems that are actually occurring in the neck. Now, they don't go into it in this particular detail, but I would argue, based on what I've just shown you as it relates to those dentate ligaments and that neural dural tension, if you've had the injury here and suddenly it's choking off the normal communication, the transmission of that spinal thalamic, that is pain information from all of the other parts of your body, guess what? There's going to be that downstream effect. Brain is not receiving the normal amount of information. And as we said, if your brain is not receiving the normal amount of information, or if it's saying, hey, damage, 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 but the damage is occurring here, but it's meant to be transmitted from, say, your hand or from your low back or somewhere else in your body, those parts of your brain are going to start to light up. And a person can go on to develop what's known as a central pain disorder. These include things such as post-concussion syndrome, chronic fatigue syndrome, fibromyalgia, cases where there is not a clear-cut lesion. There's no broken bone, there's no tumor, there's no infection, but the brain itself is not processing the information as it was before, and a person is experiencing weakness, fatigue, and or full body pain. And here's what they have to say about that. The primary axonal or nerve injury indicates that the nerves are damaged by shear or strain at the time of injury and can lead to disconnection or malfunction of the neurons' interconnection. In contrast, a secondary nerve injury refers to the condition in which axons were not damaged at the time of the injury, but evolve over a period of time from hours to days after the primary brain injury and undergo further axonal injury caused by sequential process of cellular, chemical, or tissue such as decreased exoplasmic transport. What that is that's the normal fluid that exists inside of the nerve, continued axonal swelling, and subsequent ultimate disconnection that leads to increased mortality. What that means is it means that if you damage a nerve right here, there may not be instant pain, and the nerve may not instantly die per se, but because you're going to have that localized constriction, here's that picture again, is if you have the local damage, it may not instantly cause disruption for all of the other pathways, the knock-on effect, but if you choke it off at the source, then the nerves upstream, they're going to start to dysfunction over a period of time. And because there can be that delayed onset, we often have a, fallacy in terms of, human logic. We think, okay, A must be immediately preceded by B in order to establish a causal relationship. But in the human body, there is oftentimes a delayed effect, and that's where a lot of times people can get into trouble. Either A, they don't realize that there's a connection between an injury that they've just recently had and symptoms that they're going to experience down the track, and B, they don't take the proper steps and actions. They presume and they make a fatal assumption. That is, I feel fine, therefore I am okay. And as a consequence, that underlying problem has the opportunity to grow and to evolve and to show up in weird and wacky ways that otherwise could have been prevented. So what's the take-home message here from all of this? It's that however small, however slight a head, neck, or a whiplash injury may be, again, even if there's no broken bones, even if there's not even any bleeding, and maybe not even any bruising either, that doesn't necessarily mean that there's no damage that's occurred on the inside. And if that damage is allowed to persist, it may not be causing instant symptoms, but those symptoms are quite inevitable to show up in different ways that you may never think are actually connected with that original injury. And this is the reason why, if you've ever got the car accident, the sports injury, the whiplash, if you're ever concerned, first and foremost, rule out the dangerous and scary. Go to the hospital, have the paramedics check you out, make sure that everything is okay. But just because they don't find the broken bones or the major lacerations doesn't always mean that everything is actually okay. This is why it's very important then that you're having your neck, you're having your spine properly assessed by somebody who works in the field, an upper cervical chiropractor, physical therapist, somebody who's going to take a detailed look to make sure that your joints are actually moving properly, that there was not any micro damage that occurred that in turn is going to lead to further neurological injury, pain, dysfunction problem down the track. Because it's much more important to prevent issues than it is to wait for crisis and then to have to deal with them at a later date. Thanks for watching the video. I hope you have enjoyed this one. If you do, please do click that like button. It goes a long way to being able to help other people find this information. Number 2 is if you have friends or family who you think would benefit from watching this video, please do share it with them. Number 3 is if you want a little bit more information, you can go to my personal website, drjeffreyhanna.com, where we've got all kinds of other videos, blog articles that talk about the big idea, again, how that little problem at the base of the head can have a substantial impact on your health, well-being, and can improve your quality of life. It's also how you can get in touch with me personally if you have any questions. I'd be happy to have a chat with you. And last but certainly not least, if you want more information to find out directly how we can help you out, you can go to our practice, which is clearchirospokane.com, or give us a ring at 509-315-8166. We'll be happy to have a chat with you, find out what we can do to help you out, enjoying the best quality of life that you can. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, and stay well. Till next time, take care, and bye-bye.